Hi, I'm Dr. Kelly Wallace with Catawba Heights Animal Hospital. I'm here today to answer some questions about cats and dentistry. So I have some questions here I'm going to read off, answer, and hopefully you'll learn something today about cats and their dental needs. What is involved in cat dental care? So cat dental care, there's things you can do daily at home, such as water additives to add to their water. There's dental chews. You can even brush their teeth. And then yearly to every other year, cats, just like humans, need a professional dental cleaning, which is where we go in and remove all the plaque and the tartar from the teeth with special dental tools, polish them up, fluoride, take x-rays. These x-rays look at the tooth itself that you can see, which is the crown, and then the root, which is what's under the gums that you can't see. And a lot of times there are dental issues that we can't see with our own eyes that the x-rays will show up, especially in cats. So it's very important that we take these x-rays when we're doing the dental cleaning to make sure we're not missing or leaving behind diseased teeth. What are some types of dental care at home? So like I've said before, there's water additives you can add to the water. The best thing out there is probably some dental chews. They have enzyme on them that can help break down the plaque so it doesn't turn into tartar. You can also brush your cat's teeth if they'll let you. I recommend the finger brushes and using a cat-made toothpaste. Don't use adult human toothpaste as it has fluoride in it and they can swallow it. You could use infant toothpaste that's fluoride-free. Also make sure it is not sugar-free. Some signs and symptoms of oral health in my cat. It can be, you'll see tartar and plaque, and the most common place to see it is it's going to be way back on the top molars. For humans, it's in the front on the underside of your incisors. That's where the salivary ducts dump out in humans. In animals, dogs and cats, in the upper rear teeth. So a lot of times you got to pull that gum back to see those teeth. You're not going to see it just with them eating, licking, chewing. You'll also see gingivitis, which is the gingiva, the mucous membrane right above the teeth. It'll become red, it'll become inflamed. And then some other things you can see is cats may try to eat and they're dropping their food. They may drool a lot. There may be a foul odor from the tooth. They may turn irritable. They can from pain. And they may even you can get swellings up under the eyes because that's where the roots for the upper molars are. And if they get an abscess up there, you'll swell right in here and it can even open up and drain. So we diagnose dental problems in cats with an oral exam, either awake or sedated. Once they're sedated, we do a full extensive oral exam by probing under each tooth, doing pocket measurements. And then we also take full x-rays of all the teeth with every dental cleaning. With cats, a lot of times they can have these resorptive lesions. They're kind of similar to a cavity where under the gum line, their body naturally is eating away at the enamel or the white part of the tooth, and you can't see it without an x-ray, and it's very painful. And a lot of times it can be kind of an autoimmune disease, or there could be an infection causing it. When we see those lesions, resorptive lesions, the tooth needs to be pulled. The cat is in pain at that point, and those teeth have to be pulled. And it's not uncommon that sometimes cats have to have the majority of their teeth behind their canines pulled if they're having chronic resorptive issues with their mouth. They'll be much happier without their teeth than with their teeth. I've actually had cats not eating. We go in for a dental, we pull almost all their teeth, and they wake up and they're eating, as it's less painful to eat with stitches in their mouth and fresh incisions from removing the teeth versus eating with bad, diseased, infected teeth. What are some possible conditions that can caused by poor dental care? So your teeth can affect many organ systems in your body. It can affect your ability to eat, so you could lose weight. The bacteria can enter your bloodstream under bad teeth, and it can go to your heart and cause heart issues like myocarditis. It can even go to the kidneys and cause kidney issues. And overall poor dental care can lead to a poor overall health in the pet. So we do recommend, each cat is independent. Usually cats need a dental every 1 to 2 years, depending on the cat, some more frequently than others, especially if we're seeing evidence of lesions, resorptive lesions, and those can be seen by a very reddened gum line, or you can see the gum kind of growing over the tooth in cats. That's a very big sign that there's something going on with the teeth. We are, we always check the pet's teeth with all of our exams, especially our annual exams. If you feel like your pet is having an issue with eating or with their mouth, please give us a call. We'd be more than happy to see them. We do dentals routinely here, Monday through Friday. We take x-rays with every case to make sure the teeth are healthy, to document that. And if we do have to pull teeth, we use adequate pain control. They get a topical pain medicine called Zorbium. We also do nerve blocks on all the areas where we're pulling the teeth, and that gives up to 6 to 8 hours of pain control, along with some anti-inflammatories that we send home, and usually an antibiotic if they're having teeth pulled or have infected teeth, just to make that mouth healthier. If you have any questions regarding your cat's dental needs, please give us a call, 704-827-0616.